This year, as inflation soared, the cost of family health insurance plans remained relatively untouched, rising just about 1%. But new data indicates health insurance premiums are expected to spike for employers in 2023, leaving many questioning the fate of their family's existing coverage. For more on this, we're joined on the KCBS Ring Central News line by Paul Seegert, Managing Partner, PCS Advisors. And Paul, thanks for joining us. As always, we appreciate it.
Glad to be here.
How much do you anticipate premiums are going to go up in 2023?
I think it's going to be very surprising to employers. We've had a long-term trend of about 6%, but that blends the rates between really large companies and small companies, and it hits smaller employers harder. Many have seen 10% increases for quite a few years, and it will not be surprising if we see double what we've seen in the past in this coming cycle.
We're talking about what employers pay. How much of that is going to get passed along to premium increases for the actual workers?
Well, that depends too on employer size. The smaller the employer, the more they tend to have to shift costs to consumers, and in some cases even decide not to offer health care anymore. And that's a trend that's been happening. 20 some years ago, 67% of us got care at work. Today, it's now less than 50%, and that's largely because of this trend and the fact that small employers are getting priced out of the market, and then those folks get pushed to exchange-based coverage and that kind of thing.
And do the exchanges tend to cost more than the business-supported insurance?
I think actually at the consumer level, it can work out better for those employees if they were at a small employer where they were on a really high deductible plan and having to pay, and the employer maybe could at that point only afford to cover the minimum required amount of premium in the plan. Now, I think some of them will find they're in a better situation. The trend that it creates, or the impact that it has on the overall system, can be a little troubling because not all payers pay the same when they go and get services. So this dwindling supply of employer-based plans is kind of it's a concern for the overall system, because hospitals oftentimes lose money on the transactions when it's a Medicare, Medicaid, exchange plan. These government-sponsored programs that come in may not pay enough to cover the full cost of the procedure. And those...
I'm sorry, go ahead.
Go ahead.
No, I was going to say... okay, let me do this. What effect do you think the pandemic had on premiums?
Well, it's delayed. That's the really interesting part of what we do, is that these hospitals and insurance companies get into multi-year agreements on their reimbursements. So while these hospitals have watched costs soar, and providers have watched costs of labor soar, a traveling nurse was $1,900 a week pre-pandemic. They could be $5,000 a week now, and many other things have impacted their costs, and they haven't trickled through to premiums yet because these multi-year agreements were in place. So as these get renegotiated, it creates this delay in the way that inflation impacts health insurance premiums. And that's why people are kind of surprised that maybe they've gone through a pretty gentle renewal season this time, but it's pent up. It's going to pop out in 23 because of that delay.
All right, we got a lot to look forward to, and apparently it's not going to be a whole lot of fun. Paul, thanks very much. We appreciate it.
Thanks for having me.
That's Paul Seegert, Managing Partner of PCS Advisors, telling us about the possible increases in our health insurance premiums next year.